Borderline personality disorder, or BPD, is a serious mental illness marked by unstable moods, behaviour, and relationship issues. Because some people with BPD have brief episodes, experts originally thought of this illness as a version of other mental disorders. Many experts have argued that borderline personality disorder should not be diagnosed in anyone younger than 18, since technically their personality is not yet fully formed. In the most recent edition of the Diagnostic and Statistical Manual of Mental Disorders, there is a provision that allows for the diagnosis of borderline personality before the age of 18. Technically, this provision also allows for the diagnosis of BPD in children under 13, but this is rare. People with BPD generally suffer from problems controlling their emotions, problem controlling their thoughts, impulsive and reckless behaviour, unstable relationships. People with this disorder often have other disorders such as depression, anxiety, substance abuse, and eating disorders, along with self-harm and suicidal behaviours. Whilst BPD has been viewed as difficult to treat, recent research shows that it can be treated effectively, with many people with this illness improving over time. Diagnosing BPD in adolescence. BPD usually emerges during adolescence, and adolescents with BPD commonly seek help. However, the condition often goes unrecognised because diagnosis of BPD in this age group is controversial. However, a lot of evidence indicates that the diagnostic criteria for BPD are as reliable before age 18 as they are in adulthood. Importantly, BPD in adolescence is associated with incidence of a disease that appears to persist for decades. BPD is conservatively estimated to affect between 0.9% and 3% of teenagers. But if you wind down the criteria slightly, it increases to 11% and 14%. Levels of BPD traits are highest in early adolescence and decline for most people at least into their late 20s. BPD traits in young people also show considerable flexibility, making this a key period in which to act. What are the symptoms of BPD? According to the Diagnostic and Statistical Manual of Mental Disorders, 4th edition text revision, to be diagnosed with BPD, a person must show a long-term pattern of behaviour that includes at least 5 of the following symptoms. 1. Extreme reactions, including panic, depression, rage, or frantic actions, to abandonment, whether real or perceived. 2. A pattern of intense and stormy relationships with family, friends, and loved ones, often varying from extreme closeness and love to extreme dislike or anger. 3. Distorted and unstable self-image or sense of self, which can result in sudden changes in feelings, opinions, values, or plans and goals for the future. 4. Impulsive and often dangerous behaviours such as spending sprees, unsafe sex, substance abuse, reckless driving, and binge eating. 5. Recurring suicidal behaviours or threats or self-harming behaviour such as cutting. 6. Intense and highly changeable moods, with each episode lasting from a few hours to a few days. 7. Chronic feelings of emptiness and boredom. 8. Inappropriate, intense anger or problems controlling anger. 9. Having stress-related paranoid thoughts or severe dissociative symptoms such as feeling cut off from oneself, observing oneself from outside the body, or losing touch with reality. What may seem to be minor events to many may trigger symptoms of the illness. People with BPD may become angry and distressed over minor separations from people that they feel close to. Studies have shown that people with this disorder may see anger in a face that doesn't actually show any emotion and have strong reactions to words with potentially negative meanings than people without the disorder. Suicide and self-harm. Tragically, self-harm behaviour includes suicide or suicide attempts. A large amount of people with borderline personality disorder have suicidal behaviours, but a smaller amount actually commit suicide. As distinct from suicide attempts, self-harm behaviours are not an indicator of a desire to die. Self-harming behaviours include cutting, burning, hitting, headbanging, and other harmful acts. People with BPD may self-harm to help regulate their emotions and in order to punish themselves. What to do if you or someone you know has borderline personality disorder? There are treatments that can help to reduce suicidal behaviours in people with BPD. It is often difficult to make the first move towards treatment. However, it is important to understand that there are treatment options available. To help yourself or others, discuss the treatment options with your doctor, obtain support to maintain the treatment as advised, seek specialist help, maintain a schedule of meals and sleep times, engage in moderate exercise to help reduce stress, set realistic goals, break up large tasks into small ones, set priorities around tasks, confide in a trusted friend or family member, let other people know about the events that may trigger symptoms, identify and seek out comforting situations, places, and people, continue to research this disorder, look for a long-term solution and not a quick fix. How is borderline personality disorder treated? BPD can be treated with psychotherapy. In some cases, a psychiatrist may also recommend medications. As with all treatments, when more than one person is treating a patient, it is essential for the treatment plan to be coordinated. The treatments described below are just some of the options that may be available to a person with BPD. Psychotherapy. Psychotherapy is often the first treatment for people with BPD. It is essential that people in therapy like and trust their therapist. The nature of BPD means that it is difficult for people to maintain a close and trusting relationship with their therapist. Types of psychotherapy used to treat BPD include 1. Cognitive behavioural therapy, CBT. This is a type of therapy that helps people to change unhelpful or unhealthy thinking habits, feelings and behaviours. CBT may be used to treat problems such as anxiety, depression, low self-esteem, uncontrollable anger, substance abuse, eating disorders and other problems. 2. Dialectical behavioural therapy, DBT. This therapy focuses on being aware of and attentive to the current situation. DBT teaches skills to control emotions, reduce self-destructive behaviour, and improve relationships. It seeks a balance between changing and accepting beliefs and behaviours. The theory behind the approach is that some people react in a more intense and out-of-the-ordinary manner towards certain emotional situations, mainly around relationships. DBT theory suggests that some people's arousal levels can increase far more and take a significant amount of time to return to baseline levels. 3. Schema-focused therapy. This theory is founded on the principles of cognitive behavioural therapy, CBT, then expanded to include techniques and concepts from other approaches. It combines elements of CBT with other forms of therapy that focus on the ways people view themselves. This approach is based on the idea that BPD comes from a bad self-image, possibly brought on by negative childhood experiences that affect how people react to their environment. Therapy can be one-on-one or in a structured group setting. Group sessions may help teach people with BPD how to interact with others and how to express themselves more effectively. Families of people with BPD often benefit from therapy. The issues associated with dealing with an ill relative can be stressful, and family members without their knowledge may in fact act in ways that actually worsens the symptoms. DBT family skills training include family members in treatment sessions for this reason. These types of programs help families to develop skills to better understand and support a family member who has BPD. Other therapies focus on the needs of family members, can help in a person's treatment. Some symptoms of BPD may come and go, but the core symptoms of highly changeable moods, intense anger, and impulsiveness tend to persist. People whose symptoms improve may continue to face issues related to other disorders, such as depression or post-traumatic stress disorder. However, encouraging research suggests that the recurrence of full-blown symptoms after remission is rare. Medications. Medications are sometimes used in the treatment of BPD. While there is no medication cure for BPD, psychiatrists often prescribe medication to treat some of the symptoms that accompany BPD. Medications can cause different side effects. People who have BPD should talk with their doctor about what to expect from a particular medication. With proper treatment, many people experience fewer or less severe symptoms. However, many factors affect the amount of time it takes for symptoms to improve, so it is important for people with BPD to be patient and to receive appropriate support during their treatment.